Hello, my name is Miguel, and this is the AChem Apothecary. If you join us for the first time, AChem is aromatherapy and complementary alternative medicine. We also practice plant-based and complementary alternative medicine. That's when we use the herb in tincture forms, we use the herb in tea form, and we use the herbs in many of the products. In AChem, we utilize essential oils in complementary alternative medicine. How we do that is by going toe-to-toe with synthetic medication and using the essential oils to give an option, a replacement for many medications that the side effects are too risky for individuals. Now, definitely if you need a pill, you need a pill. We're not against medications, and we definitely support medical treatment. Before we even do our work in educating the individual on the best non-toxic approach to their health, we need a diagnosis by their doctor. That's a very important thing. We don't want to cover any of the symptoms with any of the oils that the doctor needs to see. As you will learn, this AChem Synergies is extremely effective, and it's able to take care of headaches and pain and sinus problems very quickly. So we want to make sure that the person is diagnosed so we can have a proper suggestion on an option, non-toxic option for their health maintenance. Now, it is clear that mainstream medicine is going to save our life, but essential oils and plants is definitely a very wise thing to maintain our health. It's very effective, as you will see. I've been doing this for 28 years now. It's February 2015 at this point. And there's a lot of things that we have seen, and there's a lot of anecdotal information that I'm going to share with you. Things that are not covered by science, but this is what we have seen. So let us begin with, what is a synergy? A synergy is two or more of the same material. In this case, it's essential oils. So if I have, let's say, one essential oil here and another one here, the synergy, the law of synergy, what it says that it multiplies the therapeutic properties by 100. If I put another essential oil in this blend, I will then multiply that sum by another 100. And that is the power of the synergy. Something that is missed if you have essential oils that are oily. What is a real essential oil? The real essential oils are very easy to tell apart, and it's good to learn to point out that there's a difference between the essential oils used in the aromatherapy health business than the aromatherapy health practice. Completely different items, different levels. And what we have here is what we use in the health practice. The difference is, once again, the essential oils, the real ones, are not oily. They penetrate in your skin. So if you have essential oils at home, feel free to open it up right now and feel a drop in your fingertips. And if you see that it continues to be oily, it has vegetable oils in it. So it's a blend. You will never experience the power of synergy because you have a blend. The other thing that you want to be aware of is, can you leave it open? The real essential oils do not oxidize. Oxidation or evaporation, those are definitions of carcinogens, of petroleum. So the real essential oils, yes, the molecules will be diffused through the air, but I will never lose any of the liquid itself. I mean, to prove a point, I leave this open continuously. And this is my working synergies. And continuously I leave it open. The essential oils also gets better with age. The ones that are oily, the ones that evaporate, they have a shelf life of 2 years and you gotta throw them away. So that's a different area. So we're actually paying attention right now to the essential oils used in the health practice, which we call AChem essential oils. That's the materials that we have been seeing and practicing for the past 28 years, and the foundation of the AChem practice. So we begin with our first Synergy, which is the Sinus and Cold Synergy. And this is extremely beneficial to those who are having stuffy nose or having colds. And so what makes it special? Okay, we have essential oil here of lavender that has validation of being an antibacterial, antiviral, effective against the pneumococcus, streptococcus bacteria, tuberculosis facilis, and that's the science behind it. And then we have eucalyptus, which has the same properties as lavender. And we also place in here cypress, which is a bronchodilator, that allows someone to breathe easier. It's excellent for people with asthma. It's excellent for people with emphysema. And you can feel it right away if you smell the real cypress. You're able to breathe a little better. And we have here cajeput, which is what we use for coughing, to stop coughing. That's also here, which is excellent to have there. And we also have pine needle, which has the same benefits of eucalyptus, in its synergy. So imagine multiplying the therapeutic properties by 100 as we go along. So it makes this a very effective blend. Now, it's used simply by putting a drop in your fingertips, touching the inside of the nose, and inhale. Make sure you don't do this number and get in your eyes. If you do, you're going to freak out for 5 minutes and then everything's going to be fine. So it is right here. You inhale. And the next is you put some in the palm of your hand, rub it together, and rub it on your chest. Within a few seconds, you'll be breathing a little bit easier, which is the main thing. Now, if you need a pill, you need a pill. I mean, this is something that you're able to do at home in conjunction with your doctor's advice. Now, we're also able to place it in an inhaler, what we call an inhaler, which is a bottle with a large mouth. And we fill this up with rock salt and put a few drops of the Synergy. So you're able to inhale it. It's an excellent inhaler that you can take to work rather than the drops. Because the Synergies come in an 1/8 of an ounce bottle, which is 128 drops. It lasts forever because you only use a few drops. And the inhaler also lasts forever. So you inhale it and then you close it and you continue on. But this is easy to carry. In an inhaler, we also can place appetite control by putting fennel and bergamot. And it's a very effective appetite control inhaler. All the other Synergies that I'm going to share with you. Now the next one is one that is extremely effective, and many people have benefited from this. We call it the headache blend, and that is this one. And the headache blend is a combination of lavender, peppermint, and clary sage, also relaxer. And anecdotal information, what we have seen when somebody has a headache, whether it's cluster, migraine, stress, and they place a drop in their fingertips, move it around, place on their temple, come back again, another drop, touch the inside of the nose. Move your hands together and cup their hands over your nose and inhale. Gently and deeply. You can ask that person at that moment, where's your headache? 9 out of 10 headaches are gone in seconds, which is excellent. You don't have to risk any side effects of any other synthetic medication for that, and you don't have to depend on them. This has the side effect of relaxation and antibacterial. Now, the one headache out of 10 that doesn't go away like that, then we take a glass of steaming water and we put a drop or two and ask the person to inhale the steam, and then that one that didn't go away in seconds will go away when you inhale the steam. So the headache blend is one of them that is one of our, the ones that we use a lot. But we haven't done anything just taking care of the headache. If a smell can take care of the headache, what chemical smell can give you headache? And we call that negative aromatherapy. So in the practice, we begin to assess the environment, both work environment, is a new car smell, connected with headache. If you want to know more about what chemicals give you headaches, go to the EPA and hunt for it. You have them there. So it's not just taking care of a headache, taking care of the sinus, by looking for chemical exposure and human health. because we call that negative aromatherapy. It's alive and well, and the EPA calls it sick building syndrome. And we began to replace many chemicals, based products that we use in our home and in ourselves. But that's another segment. The next, Synergy is a very popular one here in Miami because traffic traffic is amazing here. So this is called the de-stress. It diffuses stress. And by the way, most of this are like 20, 22 years old, 24 years old. So we have been watching this all this time working. And one of the things that we set out to do was to observe the time frame. We read a lot of books that tells you, this is great for this is great for that. But the question is, when? When is it going to work? How many of these roots I have to eat before something happens? How many of this liquid I have to drink before something happens? So we make sure that we had a time frame so we can inform the individual in when to expect it to work. Luckily, through the olfactory system, it's immediate. And what the de-stress combination is ylang-ylang that has controlled hyperneural and tachycardia, which is rapid breathing, rapid heartbeat. It has patchouli and orange, which are extremely relaxing, in a combination of the Synergy, one drop. By the way, this is also a very nice perfume. Inside, put a little drop inside the nostrils, and your fingertips, and then touch the nostril, not in the nostril. Rub it together, inhale. And within seconds, you begin to feel the effects and the relaxation. Now, why is that effective like that? Well, a few years ago, the work of Axel and Buck, neuroscientists, were able to establish that the control for the body for emotions, appetite, survival behavior, which is our chemistry, sex and memory, is in the olfactory system. So whatever we smell, good, bad, or indifferent, will have an effect on those areas. And based on that science, it gave us a scientific anchor for those who work with aromas and therapies. So it's a really neat thing, and we see it work. Of course it does. But we need to look also chemicals and what it does to us. And that's a part that we'll talk about at a different segment. Now the next one has helped a lot of folks, and by the way, we're trying to prove all this wrong, we're waiting for this not to work, but it seems to work like clockwork, continuously. And that's good, because it's a good option to synthetic medication that has many side effects and are risky to internal organ. I mean, myself, I'm only going to risk an internal organ to save another internal organ. Definitely not for a pimple, not for depression, not for a fungal nail. It just doesn't make sense to me. So, but everybody has their decision to make in which way they want to go. I know that at 67, the essential oils and plants have definitely maintained my health very nicely. And I have no problem in getting medical treatment in anything inside of my life. So both combinations are excellent to have for a better quality of life. We definitely don't want to end up with 10, 60 medications, many of them taken on side effect of the first ones we took. We don't want to end up, if we have to, we have to, but there's so many options that we don't have to go there. So I guess the main thing is to look at your options. This was the medicine that we used to practice. This was a material. In 1943-44, pharmacognosy, which is a study of medicinal materials and some insect, was replaced from the medical school with pharmacology, the study of synthetic medicine. So prior to 1943, you'll find in medical dictionaries from Ivy League University, you'll find essential oils, you'll find herbs as antibacterial, you'll find lavender as antibacterial, you find the term AromaTherapy, which is diffusing essential oils in a sick room, the term balneo bath, which is using essential oils in bath. So this Oh, and you find them all in the pharmacopoeias prior to 1943. Pharmacopoeia is a pharmaceutical Bible for the pharmaceutical industry. So, these are nothing new. This has been proven by time and history, and we have seen many things in this when you're working with this material, not the oily one. Okay, so we have now the muscle ache synergy. The muscle ache synergy is a combination of anti-inflammatory of lavender, muscle relaxers of clarisace and sage, and analgesics of clove and birch. Now in the synergy, we know and we have seen that when a person applies a few drops of this in a hand that is hard to move, in any areas, the knees, the lower back, where there's pain, we know that within a few seconds of application, this is what we have seen. Within a few seconds of application, the pain is reduced 90% or gone. That's what we have seen. So, to the point as being so effective that we have a caution: do not use on anyone who's pregnant, because it's a muscle relaxer. And we don't want to have any delivery at early time. So this is a very effective blend. And we're able to also put it in vegetable oil, and it becomes a blend, and it will work very nicely. And we're able to put it in aloe vera gel. And then if we add, for the coolness, if we have peppermint, if we add more clove and birch, now we have icy hot happening, which anytime you have hot and cold, you have increase in circulation. So this is an excellent synergy to have for anybody who has a pain. People have been able to cut down on pain medication, which, side effect is inflammation. And so it's nice if you be able to bring plant medicines into your health maintenance. You'll find out that it's, without the side effects of medication, it's a safer way to go. The next one that we have is for energy. And these are essential oils that are known to energize, to alert. It's a combination of rosemary, lemon, peppermint, and rosemary, peppermint, lemon, and then ginger. And that makes it also anti-nausea. And for those hours of the day that your energy is low, you can smell this in your fingertips, or it's best in an inhaler, an energy alert inhaler. And it's very effective also. Remember, we're going to the control for the body for emotions, appetite, survival behavior, sex, and memory. So pay attention to what you smell, pay attention to your surroundings, because it does have an effect on your health. So be aware of that. Then we have one that is also very helpful, and this is one of the oldest ones that we have. This is a fever blister synergy. This is for those folks who get a fever blister, and if you put a drop of this, when it begins to itch, it will not open the next day. If you put a drop of it, when it's open, then it stings for a few seconds, and then it begins to close within a few hours. And in 24 hours, it's done. Once again, side effect, antibacterial, antiviral, relaxer. So there's a combination here of lavender, which is antiviral, eucalyptus, which sucks up moisture from an area. That's what we have here. It's also antiviral. And then we have tea tree, antifungal. Very effective. Those who use this are experiencing less flare-up. They flare up once a month. Once they use this, they begin to flare up once every 6 months, or not at all. So it's a really neat one to use. Of course, this is anecdotal information, not yet proven by science. And of course, and those are stress-related problems. So with this, we also do the stress blend or the next blend, which is the very effective de-emotion. This diffuses emotion. There's a combination of valerian and marjoram, and extremely effective. Valerian has been already validated as an antidepressant, and so we have it here, and we have marjoram. The combination of the two. I do know that when I place a drop in somebody's fingertips and they smell it and they're crying, they stop crying. This is excellent essential oil combination to in a situation where somebody pushes your emotional buttons and they can't. As a matter of fact, one of the tests that I do on this is I in class I put it on their fingers and they smell it, and just like that, it has to go, to your brain directly, which it does. And then in a few seconds, ask him to call somebody who really pisses him off to prove the point. It really diffuses the emotion. It's excellent if you have to go into a situation where somebody pushes your emotional buttons. All the situations that this work great is in a breakup of a relationship, in a divorce, in the death of the family. This also has helped many reduce Prozac and Zoloft that they use, any antidepressants that they use, remembering that side effects are depression and suicide. I mean, if you need a pill, you need a pill. But if you're able to take care of emotional timing, which happens to be temporary, you don't want to carry it through your life. It's a temporary situation. If you're able to go ahead and reduce it with something like this, why not? And side effect is antibacterial and, of course, relaxing. We also have a tincture of marjoram and valerian to go with this if we need to have that setup, and a tea that has marjoram and valerian and sage, which is a muscle relaxer, herbs and so forth. So that's a trio that will definitely relax anyone. And another one that we have, and this is a really a special one, because this was blended in 1993, right after Hurricane Andrew. In my area, everybody had to have a new roof, a new carpet, new furniture, and that's when we began to realize sick building syndrome, because everybody knew everything smelled, and they just enclosed themselves, because we were out of electricity for 3 weeks, 4 weeks, some of them for 2 months. So we enclosed ourselves and began to inhale all those chemical fumes, and many people got sick. But there was also a lot of mold and mildew. So we did a blend for mildew and mold that we call SBS, or sick building syndrome. Now, how it works, we're amazed. By the way, this is a combination of a lot of oils, 17 oils, I'll mention some of them. Thyme, which is excellent for fungus and mildew. Lavender, antibacterial. Eucalyptus sucks up the moisture, we mentioned that. It has tea tree antifungal. It has lemongrass. It has also citronella here. It has cedarwood atlas, and a few others. In combination of a synergy, what we have seen, and this is anecdotal information, when we spray this, let's say 50 drops in a spray bottle, in something like this, which is excellent to have for the house. This is a gallon. So in something like this, we put like 150 drops of that. And then we will spray the AC vents, or any area with the AC off, we spray the AC vent, and then with the AC off, we spray the AC filter, and then turn the AC on, and it will go all over the house. And if we have a visual on the mold, if we spray it, the next day is dust. It just falls to the floor. By the way, this is also excellent to do your own natural insecticide, because essential oils are the bloodstream of the plants. They actually attract pollinators, friends, and they repel enemies. So they make excellent insecticide. So this is one of those things that is good to have for the house to diffuse the essential oils. But we'll do a segment on natural insecticide very soon. But sick building syndrome. It's excellent one if you have a problem in the house with mildew and mold. This is a good one to have. And we're moving right along. Yeah, that's an amazing. That saved a lot of people a lot of problems in their homes. There's a lot of history on that one. Now, one of them that is we like a lot here is the insect repellent. We have in the summer we have mosquitoes that are amazing, and of course, you know, if you like animals, you like all animals. You know, it has to be mosquitoes too. I mean, it's some of us like animals to a certain size, you know, and then we begin to step on them when they get smaller. So we like animals of all size. So mosquitoes are okay. We just need to repel them. It's not their fault. The female mosquito needs to suck blood in order to have babies. So it's one of those natural things. So insect repellent, which is good because most of the chemicals that we use for insect repellent are in the list of carcinogens. So, you know, we're putting this in our children, we put it in ourselves, and it's not a good idea if we have an option. And there's an option. So in here we put together the common ones, citronella, lemongrass, but many of you don't know that lavender is also repels mosquito, and eucalyptus definitely is a mosquito repellent. That's why they plant the trees in the swamps for two things. One, to suck up the moisture from the earth, and the other one is to control the mosquito population. So eucalyptus is here, cedarwood atlas is here. It's a repellent. It's also a base note, so it holds on to the fragrance of this blend for quite a while. By the way, they have better nose than we do. They're able to detect the smell for quite an area. And so it has cedarwood atlas in here, and what else have we put in here? Oh yes, we also put in here neem, which is, it added a different level to this blend. And we just put neem about 4 years ago. Other than that, it was the combination that I gave you before. But well, what happens is we take this to the Everglades in July or August to test it. And we brought in someone who has diabetes. So if you have diabetes, you know you have the sugar levels are high, and you know you attract mosquitoes because that's what they go for the sugar in your blood. So in arriving to the Everglades, and we're camping out, they you know, began to get bitten, and then we tried the mosquito blend on them, and of course ourselves. And all throughout the 3 days, there was not one bite. And you know, we have seen this over and over and over again. So just to have something that is non-toxic, that you're able to use as a mosquito repellent on children or yourself is excellent. It also works great if you put 10 drops of this in your shampoo and shampoo your dog. Fleas don't like the smell of lavender, and ticks don't like the smell of rosemary. When you shampoo your dog with this, because mostly dog shampoos are all chemicals, and you're hugging the dog after that and kissing them, so you're getting those chemicals. So when you shampoo the dog with something like this, you leave the shampoo for 5 minutes on the dog, and then you rinse it out. You'll see the fleas just neutralize. And it's really neat because you know, you can hug the dog, you can kiss the dog, and you're not kissing heavy-duty chemicals that you're absorbing. What we're looking at, and I say we're looking at, but the National Institute of Health, the EPA, the FDA, looking at accumulative damage of chemicals from our environment, from our food, from our air, from what we drink, as a possible cause of the cancer in the elderly. So we want to be able to reduce chemicals in the air, in the water that we drink, in the beverage we drink, in the food, in the products, and the medicine we use. And that's what we're all about. If you want to know a little more, you can go to a-cameducation.com, and you can check out our certification courses for those who want to practice this as a profession or develop their own product line. You also want to go to A-Cam, A-Cam Essential Oils.com if you want to get involved with the essential oils that we use. And if you want to get involved with the Synergies that we just explained, you can go to a-caminstitute.com. That's acaminstitute.com. That's where we are right now taping. So, any questions? Feel free to write. Thank you so much for joining us. I hope you got a little information that you can use for your health and for your family's health. Until then, you take good care. Thanks so much. We'll see you soon. And remember, with this tea, this health. Take care. Thanks again. Stay healthy, my friends.